I'm going to change the agenda around, very slightly, apologies to everybody. I'm going to do the coastal care item next rather than the finance item, partly because it flows from what Katie just said, and partly because I know Amanda has only very limited time. So apologies, Neil, that I'll take things out of order and ask Amanda to introduce the coastal care item.
Good morning, good morning. My name is Amanda Fidera. I'm the Programme Director for Coastal Care, which is a major transformation programme for coastal West Sussex. Shall I talk through the paper, Chair, or would you like me to assume that it's read?
Very briefly, if you would, please.
So the paper just is to refresh the governing body's recollection of where coastal care is. Last year, we produced a business case called Inspiring Healthier Communities Together, which described a 5-year plan for services in coastal West Sussex, focused on the needs of the population and the patients. And the case for change, as it was called, looked at the population health, it looked at the finances available, and it looked at a new way of working, which was introducing a model of care that brought care outside hospitals into local communities called local community networks. And there was also a chapter on how we were going to change the accountability arrangements. And the accountability arrangements for coastal care were looking at different organisational arrangements. The business case was well supported, except that they wanted more work, partners wanted more work on the accountable care arrangements. And so what we did was focus on developing local community networks, and the paper talks about what we've done to develop local community networks and also allow the system to look at the financial recovery plan, which I'm sure that we're talking about this morning. So by way of introduction, it's just to say we have done a huge amount of work on the local community networks, and thank you to all partners. And we have done 8 initiation meetings with the local community networks. And what they are primary care working in a federated model, working with partners in Sussex Community Foundation Trust, Sussex Partnership Trust, voluntary sector, council and district and boroughs to look at the needs and the assets in the community of how they could work more collectively with patients and citizens to provide services that are different and more responsive in the community. And they've come up with brilliant ideas, very immediate solutions, which we're now pulling together in a plan and that will be available for the governing body by the end of April, with the refresh of the business case, which is also going on at the same time. So currently, because of the financial situation, we're looking at the new business case for accountable care in coastal West Sussex, based on the work that we're doing with the local community networks and further afield aligning to the financial recovery plan. So that's just a general way of introducing the paper, Chair.
Thank you very much, Amanda. Questions? Chris?
Amanda.
Hello, sorry.
Something that often confuses me, and I think might confuse some members of the audience and perhaps even some of our stakeholders sometimes. Coastal care as a term is used in 2 different ways. Mm-hmm. It's used to describe what we want to do by way of a care delivery model going forward, and it's used as the name for a putative structure or accountable care organisation going forward. And your paper talks about us having an agreed coastal care model, and we do for care delivery, we don't for
organisational.
Right.
Yes.
And I think when you use terms like that, you need to be very clear as to what is agreed and what isn't, because some people think that means we've got an accountable care organisation agreed. We haven't. So that's really just an observation, because it even catches me out sometimes as I'm reading through. No formal decision has been taken on what an accountable care structure might look like. But you talk about refreshing the coastal care business case. Coastal care here being the business case for the care delivery model we want to create. I find it hard to really figure out how you could refresh that business case without addressing the question of the structure for the accountable care thing. I'm really carefully trying to avoid the word organisation.
I've called it a thing as well.
Okay,
so.
that is going to deliver the care model that we have agreed. So it's not clear to me from your paper that you think that would need to be addressed before we look at refreshing the business case. Am I right, or am I better?
It's all, in my view, it's all part of the business case. So any change to how we currently construct the organisations that deliver care would need to answer the question, how does this enable the model of care to be delivered, the coastal care model to be delivered? So how does this support the changes to the model of care? And that's got to be answered as part of the business case.
Okay, so I would interpret what you've said, perhaps unfairly, to say we are going to focus on form as much as function from this point going forward, because they have to be addressed hand in hand.
Exactly, they have to be addressed in hand in hand. We were always very clear that we needed to describe the function, and we focused very much on the function and then had a form conversation. Partners didn't understand how the form conversation actually supported the delivery of the functions. So the new business case has to answer that question, as well as the affordability issue.
Yeah,
Thank you for clarifying. Jenny.
Yeah, thanks, Amanda, and thanks for the paper. I think my questions are quite complementary to Chris, because I want to talk about the local community networks.
Yeah.
I'm really pleased to see the take-up from our general practice colleagues and the enthusiasm for bringing services together around the patient, which is really what this is about. Mm-hmm. I think my concern is probably about implementation. Yeah. And to me, that starts with an agreed leadership and governance model of the LCN. Now, it's probably worth saying that I met with a group of practice nurses recently, mm-hmm. who were delightful. They were the lead practice nurses in their practices, and I have to say we have an incredibly capable and competent group.
Yes, I agree.
But what I wasn't assured of is that they had any knowledge yet of this. Mm-hmm. So I think there's something about how we get from a really good idea and enthusiasm to a leadership model that will really look at how we engage all our partners, including general practice staff, but also community, public health, whatever. And to me, what that requires is both clinical leadership and general management leadership.
I agree.
So I think I'm after some kind of commitment that there will be a formal plan to deliver that, rather than just an embryonic kind of. I appreciate it's got to be developed locally. But that we've got some formality around it.
Very, very much so. We've had many conversations about that. So the original intent was to have a team of people supporting the delivery of the business case going forward. But because the business case wasn't signed off in totality, we couldn't bring those people in to help the development. So, in fact, all of the CCG and providers have been working to establish the local community network conversations, but we do need to formalise that. So currently there is just an outline proposal with the provider chief execs and Katie to consider how we support the local community networks in the next few weeks, because one of the things, and I'm sure that Howard will talk about this, what we said is each local community network in the very, very beginning just needs a bit of project management support, but actually they do need to establish a leadership team, and the leadership team will need to be part of the business case. So for the next few weeks, project management support will be hopefully harnessed, and we do have some project management support already in place that the CDCG has supported, but we need to understand the leadership model, and it's not just the people, it's also the culture and the organisational development that each of the local community networks will need, because this is a different way of working. This is not the NHS just coming together with bits of primary care. This is truly how we engage the community and citizens as part of that community in delivering care differently.
Okay. I mean, I did feel that might be more developed in the paper.
Yes,
it didn't come across as strongly as you've just described it. Now, clearly, the locality directors here will have very specific views for their localities, and that's fine, but there's a bit about how we make it happen.
So there is a balance to be struck, because of course these initiation meetings we have permission to pursue. They've only just taken place, so what we're pulling together is how we support them going forward.
Thank you. Jan.
Sorry.
Thank you, Amanda. I just want to follow on a little bit more about the local community networks, and I think it's very important that the voluntary sector is involved right at the outset.
Agreed.
Because I think that has been one of the major issues that we as a CCG and the NHS and the GPs don't necessarily engage too much with them, and we've started the social prescribing project.
Absolutely.
But we've got 4 representatives of the voluntary sector sitting on our public engagement committee, and they've got links with over 200 smaller organisations, and we are very, very keen to ensure that as the LCNs are starting, that you don't rely on the local authority to use their links, but what the voluntary sector is involved right at the outset at the local level, and I think that's built in within the project.
I absolutely agree. This has got to be very different, and it's got to start feeling different very, very soon. So that's why the project management support is so important for each LCNs, because it's those links that are going to meet. Sally Polanski is sitting in my office as we speak, very, very much engaged in doing this. It is difficult because, of course, in a lot of these meetings, it's the first time that partners are sitting in the room together. So it's about making connections, exchanging numbers, doing those things that are not very easily to quantify. But Howard, I hope you'll be able to support. But it has been quite a dynamic and different process. Just the connections. The one local community network meeting we had with Howard, we were in a school, we were in an academy with the vice principal. It was just refreshing. So yes. A long way to go.
Thank you.
Lynn.
I don't want to underestimate at all the scale of the endeavour, because this is quite a new way of working that is being suggested, and then that's about to focus on prevention, early intervention, community engagement, developing community cancer. I suppose that scale of cultural change that we're suggesting will emerge through this process and must have links to public health. Is this possible? Because it is a completely new way of working that we're suggesting will be developed with the LCNs.
I always believe in life, everything's possible, but you need to give it time. And what we've got is a real need to see change happen, and yet we've got to evolve very slowly at the same time. So Kate and I have had conversations around the whole prevention agenda, and obviously public health is key. But structures don't deliver change, people deliver change, and we've got to allow them to connect and make those connections. So Glyn, yes, it is possible. It has to be possible, because the answer to what I believe are the solutions for our population health lie in doing things very differently, not in the traditional way of working.
Thank you. Right.
Could I just, following on Glyn's point, go to public health and ask the question, how ready are you to supply or guide us in the health needs and necessities for the LCN patch?
I think we're well placed. I think we've got a great deal of information on which the JSNA, the Joint Strategic Needs Assessment, is based on, some of which is hard to drill down to the small patch that we're looking at for each LCN. But I think we have been engaged very early. I think we've got a team of people who are supporting us in the research unit, what we call our research unit, who are there is enough people there to do some of that work with you. But I think what's most useful is we have been able to go to some of the LCN meetings in person and hear the conversations, which is really valuable to sort of pitch the information. So it's useful, really. So we've been engaged, and I feel we have got the analytical capacity to sort of go along with you. It's not always, it's not endless.
Okay, so what are the metrics that we're going to have as a governing body with the CCE about knowing where we are in the trajectory of the LCNs? Because we're putting so much faith in this, and to solve all our problems, not quite all, but some of our problems.
So a couple of responses there. And just an observation that at the moment, the LCNs are just the first initiation meetings. We have to allow them to form, and so we need to go from the transactional to the transformation and rebalance how we put the leadership team, etc., in place. So each LCN has reviewed all their data packs, so there's a big comprehensive data pack for each of the LCNs, not just high level but absolutely specific, come up with their priorities, and they will then be converted into what's called a logic model. So what are the problems we're trying to solve, what are the inputs that you need, what are the outputs and the outcomes against the priorities for what the system, Coastal Care, has determined as the priorities, which are the ageing population, urgent care, etc., the 4 priorities.
So how will we know that each of those have been enacted and each of those plans exist?
That will be dependent on us delivering the business case, because the business case will need to support the resources to support the LCNs, to have the data, to have the processes in place, and then it will be the overarching programme that will aggregate up across the logic model for Coastal Care, where you're really clear about these are the inputs and these are the outcomes and outputs that will be described.
So when will we see the business case? Just what's the times?
May is the times. And sorry.
Okay, so where we are. So that will be at our next governing body. We'll see the completed.
That's the aim to have it. And Rafe, just to say that there is obviously a bright group of people looking at the evaluation. So we're looking at what is the best model for evaluating the outcomes, because what we don't want to do is, whilst measuring outcomes is important, we don't want to drown each LCN with lots and lots of bits of information. So they need some freedom because they are just forming. So we've got to be clear, how many LCNs can we expect tangible changes from in the first 6 months of the programme of work?
So can I ask that group working towards the outcomes links to the PCC, the Quality Committee and the Finance and Performance? Because all of us have interest in progress.
So what we need to do, yes, absolutely, this programme of work needs to be at the heart of everything that the CCG does. So it needs to have absolutely at the heart of it. So we need to do the thing that we need to do better, which is align so that it's everybody's day job, so that those interconnections are absolutely there from the outset.
I think I'd also echo that it also needs to come to public engagement.
Okay, we need to move on. I'm going to have Neil and then Louise, and then that will be it. Do you want?
Thanks, Kieran. Amanda, I guess I've been a bit of a broken record in this respect in terms of having the implementation plan in a bit more detail and the resource plan that sits alongside it. And some of the comments there are helpful in trying to get to some of that. But this is our longer term financial recovery plan in respect.
Yes,
it's the clinical financial sustainability of services going forward. And clearly, legal directions, there's an expectation of short-term financial recovery linking with the longer-term programme.
Yep.
And we started discussions about linking those two and how to link those two. But I think there is something about, well, the first conversations when I came in was, have you got enough resource to drive this programme? Have you got enough resource to drive this programme? Still seems to be a conversation that I think we need to have, really.
Yes, and I'm sure it's absolutely, because as you know, the programme is me at the moment, with very, very helpful support from lots of people. Don't get me wrong, but it's not their day job. So it is just me whose day job it is. So I think the next important steps are absolutely to have that critical path and map of how we do this together. And we do know, don't we, Neil, that November, when the business case wasn't fully approved and the resource requirements came, they dried up. So let us now connect in the way that we need to, because this is such important business for everybody, and it is the longer term recovery programme. So that balance between transaction and transformation needs to be rebalanced. So I know we're doing that anyway. So.
Actually, my point was already covered.
Okay, thank you, Lisa. In which case, we're just going to ask Katie just to reflect on that in the context of what she was saying.
And I just wanted to say that in a fairly grim first month back, where there's been lots and lots of bad news, LCNs have just been a ray of light, and I want to say that from a personal, professional point of view. So I was in my surgery in Pulborough on Friday, and they had their first initiation meeting, and the buzz of the GPs who came down afterwards saying, we've never had conversations like this, it's great to talk to each other, but my goodness, there was somebody in the room who provides that service and this service. So, you know, I think all of the points we've discussed are so very important that we as a CCG need to make sure we absolutely prioritise our support for this and prioritise the resource. But I just wanted to put in that note of positivity that there is such a buzz about this.
Thank you, Katie, and I agree. And I think it's worth reflecting how far and how fast our colleagues in primary care have been willing to push this, for which our thanks, but also to Amanda for gripping and pushing ahead with that programme through some challenging times. So thank you, Amanda.